Now we will begin today's webinar on engaging in policy and legislative advocacy. My name is Madison McMahon Ward, and it is my pleasure to introduce today's speaker, Monica Bryant. Monica Bryant is a cancer rights attorney, speaker, and author. Monica is the co-founder and chief operating officer for Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law: An Interdisciplinary Approach. If you have any questions for Monica during today's webinar, please type them in the Q&A box. And with that, I'd like to turn it over to Monica.
Thanks so much, Madison, and thank you all for joining us today to talk a little bit about advocacy. So you may be wondering, why is it that I'm the one doing this particular webinar? And part of the reason is because not only have I engaged in advocacy for personal reasons, I've also been involved on both ends of advocacy professionally. And so prior to becoming a cancer rights attorney, I worked in this building as a law clerk for US Senator Dianne Feinstein. And then once I graduated from law school, I actually became a legislative counsel for a congresswoman out of California. So I've participated in advocacy, being an advocate. I've also been on the receiving end of advocacy efforts. And so today I'm going to give you some basics, but also try to give you some what I would refer to as insider tips on being a really effective advocate from my experience. So when we talk about advocacy, it's such a big part of what Triage Cancer does. It's all about empowering individuals to be able to be effective advocates. But what does that actually mean? Everybody has a different definition of advocacy. We happen to like this one because we think it applies to so much. So we're talking about applying pressure and influence on the people or the institutions that have the power to give you what you want. When we really boil it down, advocacy is about speaking up, but there are different types of advocacy, and this is what we refer to as our spectrum of advocacy. Today, we're really going to focus in on policy and legislative advocacy, but if you're interested in other types of advocacy, I'm going to point you to some places on our website where you can learn more. Now, when we talk about community advocacy, it can mean, again, so many different things. There's a lot of layers to this. But if you've ever helped a friend through their diagnosis or volunteered in the cancer community or spoken at an event or become a volunteer for an organization, you've engaged in community advocacy. And if you've ever attended any of our other events, you know that we try to share late-breaking news that impacts the cancer community. And so anytime you are repeating that information to those in your community, you're engaging in community advocacy. Now, policy advocacy often gets confused with legislative advocacy, but they aren't actually the same thing. Policy advocacy is specifically working for some change or support of a particular policy. So certainly that could be in a legislature, which would eventually lead to legislative advocacy, but it doesn't have to be. It could be about a healthcare professional working with his or her hospital to have the hospital change its policy on how it's going to fill out medical certification forms for when patients request FMLA leave, for example. It could be an employee advocating for a change in their dress code so that employees could wear hats at work so that individuals dealing with cancer aren't singled out. It could also be about advocating within federal or state agencies to change a particular policy or regulation. And we're going to talk a little bit more about how to write comments on regulations in just a bit. Now, here is an example, a relatively recent example of individuals engaging in policy advocacy that had nothing to do with legislative advocacy. So during the pandemic, we had school closures, and there were people advocating for certain policies to be enforced or changed. And so there were really kind of two sides in this discussion around schools. The first was about parents who were saying, open up the schools, kids shouldn't be distance learning, they need to be in the classroom, we've got jobs, we're engaging in advocacy to make sure that schools open. On the other side of the debate were the teachers saying, you've got to change certain things in order for it to be safe for us to come into school. And so here we have two groups of people who are not legislative experts having their voices heard on particular issues in their communities. A good example of policy advocacy. Which brings us to legislative advocacy. Legislative advocacy is about working to achieve some sort of legislative outcome. This could mean getting a member of Congress to introduce a new bill on a specific topic, like requiring insurance companies to cover reconstructive surgery after a mastectomy. It could also mean a governor at the state level to increase funding for early detection screenings in their state budget. It could also be something as simple as having a senator introduce a resolution declaring the importance of funding cancer research. So legislative advocacy can be lots of different things. And although we have it at the bottom, it is not necessarily the most important, but it does certainly have a huge impact on people's everyday lives. And ultimately, most advancements, both big and small, in the fight against cancer started with legislative advocacy. So we're going to talk about some helpful terms and some very practical strategies around how to be the most effective advocate. When we talk about somebody's district, what we're referring to is the area of the state or the county or the city that elected official or legislator represents. So if we're talking about the district of a congressperson, we're going to look to the state, and each state has a different number of districts, typically based on population. When we refer to a constituent, the person we're talking about is somebody who lives in that physical district of a legislator. Oftentimes you'll hear someone referred to as a member, and that's the elected official. And so again, at the federal level, we're talking about the member of Congress. So who are your elected officials? You have federal representatives. And so every state has 2 US senators. And then you have congresspeople or individuals who belong to the US House of Representatives. The number of congresspeople are going to vary based on the state's population. You're also going to have state elected officials. I will tell you the names of these different positions are going to vary by states, but all states have a governor and some form of legislative body. So in California, for example, the legislators are called state senators and assembly members. You're also going to have elected officials at the local level. And again, the names of each position are going to vary by state, but some examples are the county supervisor or a city council member, a school board member, a mayor. In Chicago, we have aldermen. And so you should understand who your local elected officials are as well. So how do you actually go about finding your elected officials? There's lots of different ways. If you go to commoncause.org, they have a system where you can put in your physical address, and it will show you all of your elected officials, starting with the president down to the city level. I happen to like Common Cause because it's a one-stop shop to get all of that information. But if you were just interested in trying to figure out who your senator was, you can also go straight to senate.gov, which is the website for the US Senate. And there's a box at the top that has a Find Your Senators button. And you'll pick your state and you'll see the 2 senators for your state. So lots of different ways to figure out who your elected officials are. Now, some terms related to the actual legislation. So when we are talking about a bill, that's something that's being proposed. And so that's going to get introduced into a session for consideration by the legislature. Again, depending on your state, they're going to be named different things. But when we're talking about at the federal level, anytime you see something that is preceded by HR and then numbers, that tells you that that is a bill that has been introduced into the US House of Representatives. Anytime you see an S in front of the numbers, that tells you that it's been introduced into the Senate. This will become important when we talk about writing your elected officials. So a bill is something that's been introduced, it's proposed. When we talk about a public law or an act, that means that the bill has actually been approved by both houses, Senate and House of Representatives, and it's actually been signed by the president. When that happens, you will see it referred to as, there's lots of different ways to do it, but usually you'll see pub.l, which stands for public law. Now, there's also lots of different places where you're going to find legal authorities. And so once a law, a federal law, has been introduced, typically there's going to be a committee vote on it, then it goes to the full house, it goes to the other house for a vote. Once it's passed by both houses and it is signed, it ends up in the US Code. The interesting thing about the American system is that many times the laws that get passed by Congress end up being the blueprint for how the law actually works. But then we get what are referred to as federal regulations. And so you'll find that in the Code of Federal Regulations, also known as CFR. So you'll see CFR and then a whole bunch of numbers. Understanding the regulations piece is another opportunity to engage in policy advocacy. And I'll give you some examples in just a minute. Now, in addition to laws that are created by, starting as a bill and being passed by both houses and signed by the president, presidents have the ability to issue what are referred to as executive orders, or EOs. And these do have the power of federal laws. But there are limits on what can be done via an executive order. Now, there are some other places you can have presidential memoranda, which don't quite have the same weight as an executive order. And again, with our system, we are a system of checks and balances. And so oftentimes what we do at Triage Cancer isn't just looking at the letter of the law, but it's also looking at how courts have interpreted that law. And you might be thinking, I'm in healthcare. Why do I have to understand any of this? I'm not a lawyer. And I can completely appreciate that sentiment. But think about over the last 10 years, how many times the Affordable Care Act has ended up in court. And so understanding how this system operates is valuable. And then, of course, we are a legal system where states have rights as well. And so we aren't just looking at the federal law, but we're also going to be looking at what exists at the state level with respect to laws and regulations. And so this is really just a visualization of what I discussed. But when we talk about federally, it is important to know who our members are, who our senators are, and how they interact, because in order to be an effective advocate, you're going to need to use the appropriate language. So when we talk about Congress, representatives or members of the House are elected for 2 years. So every 2 years, we are potentially getting a new House of Representatives. Senators are elected for 6-year terms, and their terms are on a rotating basis. So you're never going to get a full turnover in the Senate in one election. when we talk about the federal Congress, there are committees and some very, typically relevant committees to the work that we do at Triage Cancer include appropriations that deals with spending, help, which deals with healthcare, sometimes the finance committee. And what's valuable to understand about the committees is that as we talk about engaging in advocacy, committees are very valuable. And so generally when a bill gets introduced, it gets referred to the appropriate committee, and then it's up to the the majority party to decide what's going to be discussed in committee. So knowing if you're advocating for a particular piece of legislation, knowing what committee it's been referred to can help inform who you might want to go and speak to. There are also committees on the House side. And so the relevant committees on the House side are going to include appropriations, ways and means, and energy and commerce, sometimes also judiciary and approps. And so again, same idea when we're talking about the House side is that the bill will get referred to appropriate committees, and it's those committees that are going to decide, are there going to be hearings? Are there going to be, are they going to call for what's called markup, which means amendments will get offered? So looking at who is in the various committees can be helpful. Also looking at what committees your members of Congress sit on can also be helpful. Another piece of the puzzle in being an effective advocate is understanding the staff members for that member of Congress. When you stop and think about our system, we have members of Congress who really are voting on hundreds of different substantive issues a year, and they can't possibly be experts on all of those different issues. So that's where the staff comes into play. So when we talk about congressional staff, every member of Congress has a personal staff. And so these are staff members that get hired by that particular member, and every office is a little bit different in its makeup, but every office is going to have a chief of staff. This is the member of Congress, right-hand man or woman, and they're really in charge of the staff. Excuse me. Then there are typically going to be some sort of communications director or press secretary, and they're really the person handling external communications for that member of Congress. Every member has a scheduler. Become friends with the scheduler. They are the gatekeeper to that member of Congress and their staff. And so having a good rapport with the scheduler can go a very long way. Now, every office is also going to have congressional staff, and these staff are dealing with the more substantive issues. Typically, the legislative side, the head of that is referred to as the legislative director, also known as the LD. Some offices also have legislative councils. That's what I did for for Congresswoman Sanchez. And then there are legislative aides or LAs. And the way typically that offices operate is that the legislative director is in charge of the leg staff, and then the substantive areas get split up among legislative councils or legislative aides. So if you are routinely interested in engaging with your member on employment related topics or healthcare related topics, knowing who the legislative aide is that deals with those topics for your member is very, very helpful. And then finally, you're going to have the staff assistants. These are colloquially referred to as staff asses or a staff ass, and they're more entry-level staff members. They often are the ones that are going to be answering the phones, and dealing with constituents, correspondence, and letters. If you've ever gone to DC and had a tour of Congress, that tour was likely going to be led by a staff assistant. If it wasn't led by a staff assistant, it was likely led by an intern. Let me tell you, the US government stands on the shoulders of congressional interns. They do a boatload of work for no pay, and you might actually be engaging with them on a regular basis, because when the staff assistants aren't answering the phones, the interns are. Now, if a member of Congress is the chairperson or ranking member of a committee, there are also going to be committee staff. And because congressional committees have jurisdiction over specific legislation, the staff structure is a little bit different than a personal office. And these staff positions are typically highly specialized people. So standing at the top, again, it's going to depend on the committee. You're going to have somebody referred to potentially as the staff director or the chief of staff. And they manage the committee and sort of serve as the top policy and political advisor to the committee chair and majority members. The minority staff director does the same thing for the ranking member. And so I should step back. So when we talk about chairpersons or ranking members, for the party who is in the majority, they become the chair people of the committees, and the other party become the ranking members. Now, underneath the staff director or the chief of staff, you are likely going to have a chief counsel or a general counsel. And this is an attorney who oversees the legislative, the oversight, the investigative activities, typically not a political position. You're also going to have a parliamentarian, and the parliamentarian is responsible for advising the chairman, the members, and the staff on the rules and procedures for the committee. And the rules are pretty significant. Then there might be councils, there might be one, there might be many in the committee office. And these councils are similar to the legislative assistants. So typically the issue areas are split up among the different councils or attorneys, and they're responsible for, arranging the hearings and drafting the legislation and conducting negotiations. So if you have volunteered to testify at a congressional hearing, you might be interacting with the council who's responsible for that hearing. And then there might be clerks that sort of help assist the council, record votes, prepare legislation, put together reports. There are also sometimes professional staff members, and these are experts in specific policy areas. And when I mean experts, I really mean experts. They often work with councils, but they may also work with outside groups or even executive branch officials. And then finally, you're going to have staff assistants. So similar to the personal offices, these are going to be individuals who deal sort of with the administrative tasks and answering phones and setting up the committee rooms, making sure all the nameplates are out and all of that. And then, of course, our phenomenal, lovely interns who pick up the slack. So we've talked about personal office staff, we've talked about committee staff, but there's actually a third set of staff, and that's the district staff. So when we're speaking specifically about the federal level, every member has at least one office in their physical district in their state. I say at least one because sometimes senators will, especially for bigger states, might have multiple offices. Like California, for example, there's usually an office in Northern California and in Southern California. And so within those local offices, you have a completely different set of staff. Typically at the top is the district director. So this person is similar to the chief of staff, kind of overseeing the district staff. You're also going to have a district scheduler. Just like with the personal staff, make friends with the district scheduler. They are incredibly important people. And then you're going to have a whole set of people who, again, refer to different things in different offices, but they could be called caseworkers or constituent services representatives. And these are the people who deal directly with the constituents. And they will help put on events. So I know lots of members of Congress will do like health fairs in their areas. They're also really useful if someone is struggling to communicate with a particular federal agency. So, for example, we've talked with people who have had a really hard time getting an answer from the Social Security Administration. So the constituent services representative can actually help facilitate that conversation between the constituent and the agency. So now that we know the terms we're talking about and we know the players, let's get into figuring out a little bit about the actual legislation involved in legislative advocacy. If you are interested in engaging in legislative advocacy, a wonderful open source tool is congress.gov. Congress.gov is the Google of federal legislation. And so here, this is just a screenshot. I typed in cancer as a search term. And when I did this, there were 240 pending bills in the US Congress somehow related to cancer. So that's not really helpful because I don't want to read through 240 pieces of legislation. The good news is I can start to narrow it down. So let's say I find one that I'm interested in learning more about it. I can click on it to get more information. And as you can see, there's quite a bit of information. I can see where the bill is in its legislative process. So this particular piece of legislation went through the whole process, president signed it and became law. I can also read a summary of the bill. And the summaries are really quite helpful because unless you are a lawyer or you're drafting, you probably don't want to read through the actual legislative language. You just kind of want to know what it's about. Summary can be very useful. You can also see any supplemental information here on the right. So the CBO will put out a cost estimate. So how much is this, if this legislation gets implemented, how much is it going to cost the US government? Sometimes here you might see something called a CRS report, which is the Congressional Research Service. Those reports, again, are open source and are incredibly helpful in providing background and explaining a particular law. And a relatively new feature is that you can actually now sign up for a congress.gov account by email, and you can get alerts based on your certain pieces of legislation that you've asked for. So if you're tracking a piece of legislation, but you're not logging into congress.gov every day, if you hit get alerts, anytime something happens with that legislation, you'll get an alert in your inbox. Really, really useful advocacy tool. Now, let's say that I'm interested in trying to garner more support for this particular piece of legislation. One of the things that you could potentially ask your elected official to do is to show support of a bill by co-sponsoring. But before you do that, you want to make sure that they aren't already a co-sponsor. And the way that you check that is when you're on that initial screen, you'll see there's tabs across the top: summary, text, actions, and co-sponsors. When you click on co-sponsors, you'll get this list and you can actually sort it in a number of ways. So you can see by party who has co-sponsored it. You can see by state who has supported it. And then you can also just look at the list alphabetically as well. If you find your member listed here, it's still useful to communicate with them about this piece of legislation that you are advocating for. But when you communicate with them, the message is going to be about, thank you for being a co-sponsor. That is still very valuable for them to hear. Also, by taking that step, you've indirectly indicated to the member of Congress or their staff that you are a savvy advocate, that you knew to check before communicating with them to see if they had supported the piece of legislation or not. Now, the easiest way to communicate with an elected official can be by phone, by email, or by fax. There are other ways. So if you are calling your elected official, I would urge you to remember that the person on the phone is likely a very low-level staffer. So even if you are furious, and I have been there, even if you're furious, do not take it out on the person who picked up the phone. When you get somebody, identify yourself as a constituent. So you are saying to that person, hey, I live in this member's district. You need to listen to me. Be prepared to leave your physical mailing address. This is for a couple of reasons. So the first is that they want to actually confirm that you are in fact an elected official, or that you are in fact a constituent. And the second reason is many offices will follow up with a physical letter to respond to your call. So they may also ask for your email address as well. When you're talking to the member, if you are asking for support or opposition for a specific piece of legislation, try to include that bill number. HR 142, S32, whatever it is, include the bill number, because as you can see, if you just say, that cancer legislation, that doesn't mean anything. There was 240 bills that referred to cancer. Similarly, when you write your elected official, make sure, especially if you're hard copy snail mail writing your elected official, include your physical mailing address on the letter, not just on the envelope, because many times offices will open up all of those letters, discard the envelope, and just keep the letters. So you want to make sure that your address and the fact that you're a constituent is on that letter as well. Similar to when you're calling, make sure that you use a bill number and that you include an ask. What do you want them to do? Vote yes on it, vote no on it, hold a hearing, introduce a resolution. Like, what is the thing that you want them to do with your information? If you've decided to write your elected official, whether it is a physical letter or an email, keep it short. I mean, 2 pages is stretching it. And I know particularly when we're emailing and we're passionate about an issue and we have something to say, it's easy to let us go over that sort of 2-page minimum. But let me tell you, shorter is better. Oftentimes elected officials are looking for someone who would be personally impacted to tell their story. So if you're willing to do something like that, if you are public about your situation or why you are supporting something, let them know that. And this is true, whether you are an individual who's been diagnosed that has been impacted by these issues, if you're a caregiver who has watched a loved one be impacted, or even if you're a healthcare professional. Healthcare professionals have an incredible perspective on what is both working and failing their patients and families. And that perspective often gets left out of the conversation. And so even if you are not the one with the diagnosis, your story, your experience, your perspective has value, and make sure that you communicate your willingness to share that value if you are willing to do that. Now, if you are able and interested in meeting the elected official in person, you could certainly go to their Capitol office. So that could be in Washington, D.C., if we're talking about federal elected officials, or the state capitol, if we're talking about state elected officials. But as you remember, all elected officials also have that district office. which should typically be pretty local to you. Now, in addition to the district meetings, which can be just as valuable, many elected officials participate in person at community events. So, for example, in Chicago, it is very common for my state senator to participate in our local St. Patty's Day parade. And so that's an opportunity for me when I see him to just walk up, say hi, great to see you. I'm not sure if you remember, but Triage Cancer. And oh, by the way, we're hosting an event in Chicago if you know of anyone that might benefit. Can I stop by and bring some flyers to your office? Believe it or not, those sort of impromptu conversations can be incredibly impactful because they're not sort of caught up in what can be a stressful day at the office. And so just keep in mind that it's not always about I'm scheduling, I'm making a meeting, I'm going to your office and we're sitting down to talk. That's not the only way to communicate. Now, I would say that regardless of how you decide to communicate with your elected officials, certainly your message is incredibly important. The second most important thing is you're a constituent. Now, that doesn't mean that you can't communicate with members that aren't your members, but anytime you are communicating with your member, make sure they know that you are a constituent. Now, if you are meeting with an elected official in person, in an office setting, make an appointment. It is very hard. These members have, meetings every 10 to 15 minutes some days. If you just pop in, you likely won't get seen that day. Some members of Congress will have what they refer to as office hours. So like once a month, they say like it's walk-in time. So anyone can come and stand in line to come and sit down with me. Again, I don't think those office hours are as productive as a scheduled planned meeting, but that's not to say that they couldn't be. Now, if you schedule a meeting, do not be discouraged if instead of meeting with the member, you end up meeting with staff, whether that's a counsel or a legislative assistant. Sometimes, if I'm being perfectly honest, it is better for your position because the staff members are the ones who are both subject matter experts on the bill. They also understand the politics behind that particular piece of legislation and the various players. So while it's great when you are engaging in advocacy to meet with the elected official, I really do think sometimes meeting with the staff member is better. And then the staff member goes and briefs the elected official about your meeting. And so coming in prepared is incredibly important. I do think it is also very important to be kind and respectful. So even though it is their job, it can be a thankless job. And on any given day, there's somebody mad at you, whether you're the elected official or you're the staff member. There are people that don't like what it is that you are doing or that you haven't been able to do more. But recognize that more often than not, particularly with the staff members, they're there because they care. And they're meeting with you because you're a constituent and they want to hear what you have to say. If you meet with the elected official, use proper titles. So I cannot tell you the number of times that people came in and said, it's nice to meet you, Senator, when they were talking with a congresswoman. And so again, when we're just sort of setting up being an effective advocate and positioning yourself well, these small things can make a big difference. Just like in any other communication, make sure you're using a specific bill or resolution number if it's relevant, and include an ask. So make sure they understand what it is that you want them to do. I would also suggest that when you are chatting, start the conversation with something positive. even if you disagree with your elected official on almost every single thing, there's typically at least one thing you can find to compliment them on. So I'm going in to talk with my senator that I cannot stand, and I'm going to start with, thank you so much for your support of the spotted owl. My kids love spotted owls, and it just warmed my heart that you care so much about them. Now, can we talk about what you could potentially do to lower the cost of prescription drugs in the Medicaid program? It sounds ridiculous, I recognize, but starting off with something positive can really change the dynamic of the conversation and make people a little more open or receptive to hearing what you have to say. Now, if you are meeting with an elected official, keep the groups small. Like, I mean, no more than 3 people in your meeting. And there's a couple of reasons for that. The first is that you only have a limited number of time. And when you start bringing in too many people to talk, it can start to dilute the message. The other thing is, particularly if you're talking about a state elected official or the House of Representatives, offices are tiny. There is very little room to meet. The legislative staff is usually all in one kind of big, small bullpen type seating. So you have meetings where there's space. I've had countless meetings in the hallway. So when you start getting these big groups of people, there's just physically not enough place to put people. But certainly, if you have a coalition or a group of people that you're working with, bring those messages. So they can write letters, they can send, you can do a video montage and offer to email it. So I'm not suggesting that many voices isn't impactful, but when I'm talking about physically meeting with people, keep those groups small. Always take a leave behind. There should always be something you physically leave your meeting, whether it's with the elected official or the staff member. That could be anything. So it could be a newspaper article about the issue. It could be a collage of pictures of patients that have been impacted by the issue. It could be a business card, although I don't recommend just leaving a business card. It can literally be something you've typed up on a Word document and printed with your contact information, because that's going to go in a pile on that person's desk. And every so often, that person's going to clean out the pile, and it's going to be a reminder or a trigger of what you came to talk to them about. And then finally, this is something that people might disagree with me on, but from my perspective, I think it's really impactful. I believe advocacy is all about relationships, and it should be a two-way street. So it's a really nice touch to ask the person that you're speaking with towards the end of the meeting if there's anything that you can do to help them in their efforts. This is not something that many people think about doing, and I would venture the guess that it will make an impression with the person that you're meeting with. So what are some things that you can ask of your elected official? Well, if there's no legislation on a particular topic, issue area that you think should be improved upon, you can certainly ask them to introduce a bill. Senator, please introduce a bill to impose an out-of-pocket maximum for Part D coverage. I would definitely recommend before you suggest introducing a bill that you have checked to make sure there isn't one already. Or if there is, but it's inadequate, perhaps you can suggest introducing an amendment to an existing bill. When members introduce a bill, they will often send around what are referred to as dear colleagues. And these are letters that are written to their fellow members of Congress, their colleagues, explaining a topic, explaining the piece of legislation that they've introduced, and asking them to co-sponsor. So if you are suggesting that someone introduce a bill or a resolution, it might be helpful to offer some language or information that they can include in a Dear Colleague letter. If there is a piece of legislation that exists and you are hoping that that member support it, what you could potentially do is ask them to co-sponsor it, or to vote for it, or to vote against it, or to support funding for a particular program. Certainly you can ask them to vote yes or no on a judicial confirmation, or maybe just to request a hearing. I mentioned that a really nice touch is to offer if you can be helpful to them. So what kinds of things might be helpful? Certainly any sort of background information or data that you have can be helpful. Providing context for a particular issue, how is this legislation potentially helpful for the cancer community? If you feel comfortable, might be sample language, or you could testify at a hearing. I just watched a congressional hearing on the lack of childcare, and the expert that they brought in was a full-time single working mother. And so don't think that you have to have any sort of special expertise on a topic. Your expertise is you're living and breathing this issue all day long. It could be about telling a story in a local newspaper to garner support for a piece of legislation, or organizing an event. And it could just be about being a subject matter resource. Hey, feel free to reach out if you ever need anything on this topic. I have tons of stories to share with you. And of course, these are not exhaustive ways that you can be helpful. They're just things to get your mind going. Now, once you've had the meeting, send a thank you note. Please, please, please send a thank you note. Not only is it generally good manners, I believe, but it's another way for you to get your position in front of the right people. So I even recommend, excuse me, sending a quick email right after the meeting. Thanks so much for sitting down with me. Attach whatever leave behind to the email, because some people prefer electronic files to hard copy files. And then also send a quick little hard copy note. Staffers are so busy. They get hundreds of emails a day and probably have 8 to 10 meetings a day on a slow day. Anything you can do to jog their memory about you, your meeting, and the position you're taking is worth it. So in your notes, whether it's email or hard copy, you can include any additional materials. So maybe they asked a question in the meeting and you didn't have the exact statistic with you. And so that's an opportunity to say, hey, you asked about X, here's the article or the study or the whatever that answers your question. The goal here is to be helpful and not to overwhelm them. And so when you email them, you're going to thank them for their time. You're going to reiterate your position that you'd like them to take, and then you're going to include your contact information for follow-up. So it can be as simple as this. Dear Senator, thank you for taking the time to meet with me to discuss the needs of cancer patients. I'm so honored to have the opportunity to share my experience with you and our shared love of spotted owls. I appreciate your support and hope you'll vote yes on 123, on S123, the Protect Cancer Patients Act. I've included some background materials. Please feel free to contact me at my phone number or my email if I can ever be of further assistance. Sincerely, Rockstar Cancer Advocate. Here's my address again. Ding, ding, remember I'm a constituent. So this is a perfectly wonderful, well done thank you note. So it doesn't have to be a lot. Now, we've mentioned about checks and balances, and so it is helpful to understand our basic system of government. If you have questions about this, I refer you to the advocacy page of our website for more details. But I wanted to bring up our checks and balances to introduce the fact that when we talk about legislative advocacy, we aren't just talking about Congress, but in fact, the court system can play a very important role. And so when you are thinking about ways to be an advocate and thinking about whom you might want to vote for, looking at their track record of how they have supported or opposed certain judicial appointments can help inform you for your decision. And you might be wondering why I say this. And I say this mostly because there are so many times that the court system has made rulings on the particularly constitutionality of particular legislation like the Affordable Care Act that impacts everyday American lives. So the message here is, don't forget that the judiciary is a valuable piece of your advocacy efforts, as is the executive branch. And so when we talk about the executive branch, these are typically where you're going to find the agencies that are useful or important in your efforts. So some of the agencies that we spend a lot of time with at Triage Cancer include Health and Human Services, the Department of Labor, and sometimes even the IRS. And agencies will put out what are referred to as rules. When they put out these rules, they do so by first putting out an interim rule. And when they put out the interim rule, what they're essentially saying is, here's what we're thinking. Here's how we're going to implement the law that the legislative branch passed. And then they give us as constituents an opportunity to weigh in on the rule. And the way that we weigh in is by commenting on regulations. Now, anybody can write comments on regulations. And so it could be you as a person. I think this rule is fantastic. I wish I would have had it when I was going through cancer treatment because I had no paid leave. It could be an organization or a coalition that you're a member of. As New England social workers, we think this is going to be very harmful because of X, Y, and Z reasons. It could be a company. And so really anybody can comment on regulations. The way that you do so is actually going to regulations.gov. It's an online form that you fill out. And that's where you can ask them to support it or oppose it, or even ask for clarification. So in the regulation, you mentioned small businesses, but there was no size. Like what constitutes a small business? You can also put in recommendations. So, in addition to these types of professionals, also include patient advocates as a type of professional that can sign these forms. I'm making all of this up, but just trying to give some examples. Now, it used to be a more arduous process to comment on a federal regulation, but as I mentioned, now it's just a form. And if you go to regulations.gov, you'll see the various levels of comments. There are some that span pages. There are some that are a single sentence. So please don't be intimidated by the idea of commenting on regulations if you have something to say. Now, for many people, the idea of legislative advocacy is overwhelming, but it really doesn't have to be complicated. So certainly you can be an advocate on your own. You can write letters to elected officials. You can get on regulations.gov and comment. You can raise awareness just by sort of sharing what you learned today, if you learned something new today. But still, that can be a lot. So other ways to get involved include joining an organization's advocacy efforts. So it could be about, maybe it's a cancer specific type of organization like lung cancer. Maybe it's an organization that is working towards lower out-of-pocket costs. Joining these organization efforts can be very useful to stay up to date with what's going on. And then they can also suggest ways for you to engage. But the good news is, the most impactful and important thing that you can do to be a legislative advocate is also the easiest, and that is to vote. Because if you don't vote, you don't get to complain, at least to us. And I realize that this sounds incredibly harsh, but it's probably one of the most honest things I can say to you about legislative advocacy. In this country, we are so fortunate to have a say in who our elected officials are, and your story is important and your vote is important. And so if you don't make your voice heard by voting, you're actually missing out on an opportunity to affect change. And there are countless times that people will reach out to Triage Cancer with a particular issue, and then we find out what state they live in, and we have to say to them, I'm sorry, what your cousin in California told you isn't true because you live in a state that didn't vote for that. And so it is important to be taking into consideration voting, and not just voting every 4 years in presidential elections, because cancer really is a political issue. And here's just a quick example of what I mean by that. So there was a budget resolution that lowered the, the penalty for not having health insurance to $0. And that caused a lot of confusion. And so a survey was done asking, has Obamacare been repealed? 49% of respondents said no, 31% said yes, 21% were unsure. Now, just so we're all clear, Obamacare, or the Affordable Care Act, has not been repealed. It is still law of the land. The problem here is 52% of people who answered this question were either wrong or unsure. And when we break down who was wrong, 44% of those people were Republicans. And so what this illustrates to us is that people's understanding of our system is unfortunately breaking down by party line. And here's the thing, I'm not talking about should it be, shouldn't it be, is it a good thing, is it not a good thing? We're talking about the fact here. And the fact got skewed based on people's political affiliation. And this is just one example of many where this comes up. And so when we talk about cancer as a political issue, it very much is. Now, the other piece, as I mentioned, was that we can't just be thinking about voting and politics and elected officials every 4 years when it comes to presidential elections. Every 2 years, we have what are referred to as midterm elections. The reason they're called that is because it is in the middle of a presidential term. And so why do I say this is important? Well, there are a whole bunch of things that happen at the state level that have a huge impact, both positively and negatively, on the cancer community. And so here's an example of this. So through the Affordable Care Act, there was created a new way to access Medicaid. Previously, people had to have low incomes and asset levels and have a very significant disability in order to access healthcare in this way. So the ACA created a new way to access healthcare that was just based on having a low income. So the original 4 doors that include the income and resource levels still exist, but ACA added this 5th door to walk through. And this 5th door was supposed to exist nationwide. Unfortunately, the Supreme Court got their hands on the ACA and issued a decision that essentially made it voluntary for states. And here's where we stand today. We're 39 states through either their legislature or a voter referendum decided to expand their Medicaid program. But 12 states still have not expanded. And this is primarily based on the political makeup of their legislature and their governorship. These 12 states represent about 3 to 5 million human beings who would have had access to healthcare had their states expanded, but don't because of this choice. And so When we talk about looking at the state elections as well as the midterm elections, this is just one example of why it is so important. And so this coming November, we will have midterm elections. And in these elections, there will be 35 Senate seats. Every single one of the 435 House of Representatives will be up for election, and 39 governorships. So keep in mind that as we go into election season, there are some pretty big issues on the table that have nothing to do with the president. Now, the final sort of piece of this puzzle is our judges. And I talked about the Supreme Court, but that's not the only place where judicial appointments or elections are potentially impactful for the cancer community. But I know even myself, sometimes when I get to the ballot and I have to vote on judges, I'm thinking, I don't know who any of these people are. So how can you get educated enough to make the decisions that you want to make? I generally suggest looking to the experts on judges. So looking at your state, county, or even your city bar association to see if they've put out any sort of voting guideline. If you feel like the issues you care about tend to be political in one way or the other, there are typically state or county political parties that could put out voting recommendations. There are also some nonprofit and advocacy groups that might get involved in helping to educate the public about the judges. So doing that before you get to the ballot box can be useful. Now, you might be thinking, this is a depiction of how I feel on a daily basis. So how can I possibly add one more thing to my to-do list? And I get it, I really, really do. But I hope that I've made the case that not every advocacy effort has to be time consuming. For example, if you join one of those organizations' advocacy efforts, they will likely send emails when there's time to act. And this is an example from the American Cancer Society's Cancer Action Network. The email gets sent, it explains a little bit of the issue, and then there is a link. You click the link, you put in your name and your address, and then the system will send your letter to the appropriate elected officials. So the one, your elected officials based on your address. Takes what? A minute, maybe two to type in our name and address. Most of us can probably find 1 or 2 minutes every so often to engage in legislative advocacy. Now, I often will get questions when we're in person about, well, okay, great, this letter gets sent, but does it actually do anything? Does it actually have any sort of impact? Now, I used to only have anecdotal evidence that these letters were helpful. Thanks to Senator Feinstein, I now have actual evidence. So she tweeted about how literally she counted up the letters, calls, and emails about a particular issue. And that was helping, inform and support her position. So just because you can't write your personal manifesto doesn't mean that these smaller advocacy efforts aren't impactful. So great. Hopefully you've learned a few things about advocacy. Now, what are some of the substantive opportunities to engage in advocacy? There are quite a few areas of law that are currently hot topics to the cancer community. And so when we think about at the federal level, we could be talking about paid sick leave. So this became a hot button topic during the pandemic, and some temporary fixes were put into place. But certainly many of them have expired, and they still left some pretty significant gaps. We could be talking about expanding the FMLA, and that could be a whole host of things. So lowering the employee requirement so that more Americans could have access to it. Or maybe it's about more time, or expanding the definition of family. Certainly could be about having paid FMLA leave or caregiver leave. Maybe it's about dealing with disability insurance through our Social Security Disability Insurance Program. Right now, there are pretty significant barriers to accessing both disability insurance and health insurance. if you have a serious medical diagnosis and can't work. So maybe advocating to close those waiting periods. Right now, Part D coverage in Medicare, which provides prescription drug coverage to seniors and individuals with disabilities, doesn't have an out-of-pocket maximum. And when you start to think about how much cancer drugs cost, that lack of out-of-pocket maximum is a significant barrier to care for many. And then maybe it's about providing caregivers more access to flexibility in their workplace due to their role as a caregiver. So lots of opportunities at the federal level. There are also some opportunities at the state level as well. So we've discussed Medicaid expansion for those 12 states who haven't expanded. Perhaps it's about medical marijuana. Paid family leave is also an issue that has been addressed at the state level in a handful of states. Certainly in the states that haven't dealt with it yet, that's an opportunity, or access to Medigap. And so these are just a few of the legislative issues that could impact the cancer community. And as you can see, only a few of them are actually cancer specific. So as many of you know, laws around paid family leave or Social Security disability insurance, those have the potential to impact people even outside of the cancer community. So if you're interested in learning more about these issues or sort of staying on top of when there are advocacy opportunities, I would definitely encourage you to subscribe to our blog, because then you'll get that late breaking news in your inbox and you don't have to kind of stay up to date on your own. So this is just a quick example of ways to engage in advocacy if you're on social media. So if you are, let's say you're an individual who's been diagnosed and you are not public about your cancer diagnosis, there are still ways to be an advocate. So you tweet, you tag your member, Senator Joe Schmo and Representative Bill Jones as your constituent. I ask you to please expand access to Medicaid in our state. So you haven't actually disclosed any information about yourself except you're their constituent. Let's say though you are very public about it, then you can add in something to the effect of, as someone with cancer, this is why this matters to me. And it just shows the difference in how you can still engage even if you aren't disclosing publicly. If you are interested in engaging in legislative advocacy, social media can be a very useful tool. We have some resources on our website, including all of the social media handles for the current federal Congress. Now, when we're talking about legislative advocacy, you might be sitting here thinking, okay, great, I've listened to you now for an hour. I'm a nurse, I'm a social worker, I'm a caregiver. Like, what impact can I actually have? And my answer to you would be tons. People often forget that elected officials work for us. And so if they're not making people happy, they can lose their job. And so members listen to their constituents, and it's really why it's so important to say that you're a constituent, that you live in their legislative district whenever you reach out. So the first characteristic of a successful advocate is just believing that an individual can in fact make a difference. But successful advocates also have to have passion for what they're doing, what they're working towards, and a commitment to change. Now, I would venture to guess that you all wouldn't be spending your time listening if you weren't passionate about what it is that you do or the idea of affecting change. Now, if I could see you, I would ask you to raise your hand if you thought our healthcare system was perfect. And there's nothing you would want to change it. I'm pretty confident that I can assume I wouldn't see a single hand. So I think that we've got this one covered. Successful advocates also understand the need to collaborate. And this can be challenging, especially in the healthcare world. But legislative advocacy is a great place for us to come together. And this is just one example where Triage Cancer was able to collaborate with so many different organizations, and I'm sure some of these logos look familiar, when we were pushing senators to vote no on an effort to repeal the Affordable Care Act. And what was so interesting is all of these organizations agreed on a point of view, got together, and publicly urged members of Congress to act in a certain way, which is a classic example of advocacy in action. It's also an opportunity to look outside the box. And so some of these issues aren't just about the cancer community. So thinking about what other entities or organizations would feel similarly and bringing them into the fold. Now, successful advocates know that they have to be patient and persistent, and this can be hard, especially if you're like me and you like instant gratification. But patience is necessary for any successful advocate, and it can often take years of talking about an issue before a bill is even written, and then multiple congressional sessions for a bill to get a hearing, let alone a vote. And so my example of this is the late Senator Edward Kennedy. He worked for healthcare reform his entire tenure in the US Senate. He introduced the first healthcare reform bill in 1970. And it wasn't until 7 months after his death that the Patient Protection and Affordable Care Act was signed into law in 2010. So for perspective, that's 8 different presidents, 7 terms in Congress, and 40 years to get healthcare reform passed. And it's still not perfect. In order to be an effective advocate, you have to educate yourself. Now, I certainly don't think that that means you have to become an expert on a particular legal topic, but it is important to know where to send elected officials if they do want an expert. So, for example, if you were talking with your senator about expanding FMLA rights to include the ability to take time off for a sibling, it might be helpful to know that Triage Cancer has cancer rights attorneys who are experts in this area. You can tell your personal story to the elected official and then send them to an organization that has the technical expertise to support your position. Now, even if you've done everything that I've talked about today and you are the perfect advocate, you may not get what you want. Roadblocks are common and it's usually pretty frustrating. Look at this little guy. At first glance, he is stuck on his back with his 2-inch little legs, and how's he ever going to deal with this? It is impossible for him to cope with his situation. But this is where perspective comes into play. Now, I can't always say that I am successful at this, but I find the more optimistic I can be about things, the better life tends to be generally. So I'm certainly not saying that you shouldn't get upset or frustrated, but I hope the end result isn't quitting. And while I wish I could leave it there, there is in fact more. Because even if you are successful in your advocacy efforts, your job isn't done. Because if all you needed was a law, you wouldn't need lawyers and you wouldn't need law enforcement. The next step is actually at the heart of what Triage Cancer is all about, which is educating the community at large about how the laws can be used effectively. And we do, in fact, need all of your help to amplify that education as well. So with that, I'm going to say that I hope you have found this useful. I am going to switch over to questions in just a minute, but please know that this isn't your last opportunity to get information. So at triagecancer.org, we have a topic hub on advocacy, which talks about all the different types of advocacy and has some practical tools. And certainly keep up with our blog and engage on social media for any sort of late breaking news that might come up.